This is Freedom Medical Center with how to inject medication and how to draw it up. When you get your medication in the mail, you are going to get a box that looks like this, likely with some ice packs in it, probably one on top of the medicine, one underneath, and then the medication vial in the middle. Your medication vial will look different depending on which medication that you're on. This is a vitamin, so it will definitely look different than this, but it works well for a demonstration. You will look on your prescription at how many units you need to inject. You'll get alcohol in your kit and you'll also get syringes. These syringes are marked in units. The units on here will correlate with the amount of units that you need to inject. So you'll look at your prescription and it'll say 25 or 50 or 12, some number of units, and then you'll find how many units there are on the syringe and you'll pull it up to that number. So let's say it's going to be 20 units. When you pull up your medicine, which I'll show you how to do, you're going to pull it up to the 20 units. If you have any questions, always feel free to contact us. You are not looking for milligrams or milliliters. You are looking for units. The units on the syringe match the units that we're prescribing. And then you have alcohol. We do what's called a subcutaneous injection. So that means this injection is going to go into the fatty tissue. We're not trying to get it into the muscle like a flu shot or something like that. We're going behind the arm in this fatty tissue, in your thigh, in the bottom of your stomach. Any of these places will work well. If you have questions on that, again, please let us know. But what you're going to do is you're going to take your vial and you're going to take your alcohol. You're going to clean off the top of your alcohol at the time of your injection, and you're going to take off the top of the cap of your insulin syringe, and then you're going to inject it into the rubber stopper. Now, oftentimes there's always a covering on top of that rubber stopper, so you will have to take the covering off in order to expose the rubber, but then that needle will go really nicely in there, and then you're just gonna pull out, if you're doing 20 units, you're gonna pull out 20 units of medication and give it time so that you don't get any air in that, and you'll just kind of want to get the air out. So if you notice, this medication is almost out, so I'm having to kind of take the needle out a little bit in order to get more medicine. And I'm going to push it up. So we only have 12 units of medicine left in that vial. So that would be the 12 units if you were on that prescription. That's how much you would put in. Your medicine is likely not going to look like this either. We just wanted to use a colored one for the demonstration. And then what you'll do is you'll clean off whatever part of your body that you want to put it in, whether it's the back of your arm, the bottom of your abdomen, or your thigh, and you'll kind of pinch it and then you'll inject. Now, since I can't inject the back of my arm, I'm going to use the styrofoam as an example. You'll just put the needle in and inject. You can kind of see how it just kind of goes out. Easy peasy. It'll last a week. So most injections will tell you the frequency, but most injections are going to be once a week, and you'll want to stay really consistent. Now, sometimes you might have a little extra fluid left in your vial. You only want to use these vials for 4 weeks. After 28 days, you increase risk for infection. So we do not recommend that. And you can travel with them if needed. I also recommend only pulling up medication when it's time to take it, unless there's another reason. It just helps increase the sterility as well and decrease that risk for infection. If you have any questions or concerns or need to walk through your medication administration in the clinic, we're always happy to assist you with that. We welcome you to come in and bring your medicine, and we'll do it together. Thank you so much for listening and learning, and we hope this empowers you to feel confident in pulling up your medications.